Hi, this is Dr. Paul. I want to talk to you about a common problem I see, which is ADD or ADHD, which stands for attention deficit disorder or attention deficit hyperactivity disorder. Very misunderstood problem. I mean, people hear about it a lot, but basically it's a condition that really starts in childhood, even though some people, it comes out more as an adult, but most people have it their whole lives. And the reason it's not seen really is if it's really mild sometimes, or, sometimes years ago they really didn't pay much attention to it. But these are kids who struggle in school. Sometimes they're inattentive, they just space out and kind of doodle and stare out the window and not listening to what's going on. Some kids are hyperactive. Some kids get very impulsive. They're very impulsive kids. But some kids get by with just their natural intelligence and sometimes work ethic, especially if they have parents on board who are really working with them to get the work done and get their homework done on time. And so sometimes you can get by with ADD unless it's really severe, where just kids are just not able to do it in school. But sometimes people get by. They get bad. They progress through school. But then sometimes it gets worse the farther you go in school. Like high school is worse than middle school. College is worse than high school. Graduate school is worse than college. So sometimes it gets progressively more difficult to function. Typical symptoms are poor focus and concentration, easy distractibility, difficulties just staying on track with things. Difficulty like tasking, difficulty with reading, because people say I read, then what did I just read? And I have to read it again and then again. Sometimes you have to kind of reread because you kind of space out and not really comprehending what you're reading. Interrupting others sometimes, because you have a thought and boom. Like squirrel, and so it's a very common condition, and like I said, it can get worse. Like even sometimes jobs, not just school, but sometimes at work. If your work requires focus, like a lot of work does, then it gets worse. Now, some people say it's fine with certain things, like in sales. Let's say some people say I'm okay when I'm selling, I'm going to seeing clients. But it's when I'm at my desk doing paperwork and catching up on emails, and that's when it gets really bad, is when I have like a lot of especially boring things. If you have a lot of boring tasks you have to do, it's really difficult sometimes if you have ADD to get those done, or you kind of put it aside for later and then you never get to it, and then eventually it becomes an emergency. So this is ADD. It's extremely common. It's very undertreated. So the misunderstanding about this is that people think it's a weakness. It's like a weakness in your character. It means you're not trying hard enough. You just need to buckle down. So a lot of kids get shamed, and even adults get shamed because people just think, oh, it's just you. It's just if you were. So it makes it difficult because kids already have probably decreased self-esteem at this point. And if you don't treat kids, when they get into the teen years, addiction rates are higher, they get in trouble easier, more crime. So there's consequences of not treating it. Now the problem is the treatment is controversial. So when we talk about stimulants, like Adderall is the most popular one, Ritalin, Vyvanse, I could go on and on. There's multiple medications I've worked with over the years. So the stimulant class gets misunderstood because people think that's speed, that's terrible. You can't give someone a speed. They might as well just go on the street and get meth. When people say these things, it's very frustrating for me because they don't understand what they're talking about. They don't understand ADD, and they kind of, or they think it's like opiates, like, oh, you're going to get addicted to that. No, you don't. When you have ADD, you don't get addicted to ADD medications. They're the treatment for you. And people think they're going to get all sped up on them, but the reality is with ADD, the medications actually calm the brain down. People say I have more of like a calm focus. And so the problem with this misconception about medication is that a lot of parents don't want to treat their kids because they think it's wrong, or they listen to their friends, and they just think it's just wrong to give my kid a stimulant. And even adults feel like shameful at times, or sometimes what's strange is the pharmacy will give people an attitude about it, and look at them funny, like, oh, you don't really need this, or So it's just there's so many. It's probably of anything I see in my practice. It's the conditions that there's the most misconceptions about. And like I said, there's so much out there that ADD is not treated. The problem is it's undertreated. It's not treated too much. Now, of course, there are people who don't have it and abuse medication. Well, sure. I mean, there's always going to be people like that. But again, these are the same people that probably would prefer street drugs, over the prescription ones. So they probably, they're cheap. The street ones are cheaper. And if they're trying to get high off of them and they don't have ADD, then they're more interested in the illegal stuff. So let me give a quick explanation of ADD on a neurochemical way. So basically, again, the nervous system's composed of 100 billion or so nerve cells connecting by chemicals traveling from cell to cell 1,000 times around the body a second. There's over 100 trillion connections between the cells. We call the synapses. So the chemicals I look at are serotonin, norepinephrine, dopamine, GABA. So those are I call the big four. And they should be moving this way, forward, all the time. So with ADD, it's not a serotonin issue. Basically, it really has to do with the chemicals norepinephrine and dopamine. And what happens then is that they open up, the holes open up, the receptors, and they cause the chemicals to shift the wrong direction. And if they're not firing properly, this leads to the symptoms of ADD. And why does this happen? Genetics runs in families. So that's why. And can it get worse with certain things like puberty? Yes, but again, it gets worse as you age if you don't treat it. It's not a life or death treating ADD because it doesn't lead to suicide like depression can, bipolar disorder can, but it leads to dysfunction in life. It leads to the fact that you're not living the life you should be living. You're not achieving what you can achieve. And that's sad to me when someone is not able to do their best. There's probably nothing more dramatic in my practice than treating ADD, especially for someone in the first time who's treated it, and they're just shocked. And they say, oh my God, I should have been treating this my whole life. I go, yeah, you should have. But we can't go back. We can go forward, but it's pretty shocking when people realize, like, oh my gosh, they think back. I would have probably gone to this school. I probably would have gotten a graduate degree. I probably would have gotten a better job. I probably would have elevated in my job easier. Yes, true. All those things are true. So what stimulants are doing are what they do is they stimulate the chemicals to connect better. So what they do is they stimulate norepinephrine and dopamine to move forward. And when they go forward, boom, focus. What they also do, interestingly, which is great, is they also attach a little bit to the sites. They attach to the norepinephrine and dopamine sites, and they prevent a little bit of the backflow, sometimes like an antidepressant would do, which is why sometimes they have antidepressants effects, and they help with anxiety because of the fact that with the antidepressants and anti-anxiety medications, they also get chemicals moving forward. But this does it, Adderall or whatever medication we use, does it much more efficiently and better. Now, you may hear of other medications out there that people take, like Strattera. Strattera is not a very impressive medication, in my opinion. I've had some people on it to do well. Sometimes I put people on that if they can't tolerate stimulants. So basically, it's a norepinephrine reuptake inhibitor. So all it does is it attaches the norepinephrine and prevents the backflow, which means it's going forward, which is good, but it's not going forward quickly like a stimulant would do. Wellbutrin can be helpful. It's a norepinephrine and dopamine reuptake inhibitor. So it tightens these receptors up a little bit more, and it makes the chemicals move. Now, Wellbutrin is not great by itself for ADD. It's okay for some people, better than nothing sometimes. But when I add it to a stimulant, it can be really good. Not for everybody, But for some people, you get the benefit of the stimulant, and then it tightens up these receptors even further. So then you get then they don't go backwards. See, then they go forward, but then they can't crash because Wellbutrin is blocking them from doing that. So that Wellbutrin stimulant combination is something I very commonly, and sometimes there's depression and ADD. So if there's depression and ADD, then Wellbutrin is a really good antidepressant to use in that condition. But like I said, there's so many misunderstandings. Hopefully this helps to simplify this subject, because it's something it's really near and dear to my heart, because I have so many people I've seen over the years with this. It's so exciting to see their lives change and seeing and it also not only helps work, but it helps communication. It helps with the family. It helps with the spouse or the significant other. It can just help with everything in life, and just life is just better and happier when you're treating ADD.